Well, Sarah, we've heard about the risks of home-based care. This bill specifically coming after a visiting nurse in Willimantic, Joyce Grayson, was killed on the job. This new proposal would require providers contracting with the Department of Social Services to give training to staff on workplace violence prevention. It would also fund escorts for home visits deemed hazardous and increase timely reporting of any violence or harassment issues. Healthcare workers and advocates testified today in support of this bill, citing data from the American Nurses Association that 1 in 4 nurses reported being physically assaulted while at work.
Tragedy strikes one of our own, it reverberates throughout our entire profession. Joyce Grayson was a home care nurse who was killed while providing home care services to her patient in a home. Although many of us did not know Joyce personally, we all know Joyce. She was a nurse, and nurses understand the fear and vulnerability that comes with being a nurse. All nurses deeply felt this tragedy, and it should never happen again.
Now, the commissioner of the Department of Social Services also testified at today's public hearing and actually spoke in opposition of this bill, saying the fiscal impact would be too high for the department to support. But they did say DSS is currently working on other ways to provide more monitoring and safety for workers, like personal alarms or different phone apps. The commissioner called Joyce Grayson's death horrific, and so the department is actively communicating with home healthcare agencies across the state. Lawmakers, though, want to keep worker safety a priority this session.